second episode here at BCBH of our podcast. So I'm Luis, and this is...
I'm Norma.
All right, so thank you guys. Before we get started, just don't forget to subscribe and like. I'll probably mention that again. Check us out on bcbhlv.com. You get all our information there. That's our website. And for any stragglers out there, we are located in Las Vegas. So if you're looking for mental health services, look us up in Las Vegas. So should we get started?
Let's get started.
All right. So last episode, guys, we let you guys know that we were requesting that you guys submit any questions or comments that you wanted us to talk about, and some of you did. So thank you guys for that. Some of you guys used the comment section on YouTube. Others submitted their questions through our website. Either way is fine, so whatever works for you, it'll work for us. So, but thank you for you guys that did submit that. And we got a lot of questions regarding mental health and just different questions regarding the basics of mental health. So today's focus is going to be on that. It's just general information that for some of us clinicians we might take for granted just because we're in the field, but for people that have not been to therapy or even those that have, might be a little bit confusing. So today's just kind of, we'll try to give you guys some information to hopefully clear things up. Anything to add, Norma?
That's right. No, we want to start with the basic questions and the basic information so we know what we're going to be talking about in the future. And we're going to be focusing on, we're going to be having some questions and talking about some specific subjects, but that is what we're going to be doing today. Right?
Okay, sounds good.
Yeah.
So Norma will be asking the questions.
So
I'll do my best to answer.
Yes. So let's see. We're going to start first with what is mental health.
Good question. So what is mental health? So that is a hard question to answer, but mental health is just like physically, right? So if I asked somebody what physical health is, they would say, well, how do you feel physically, right? Do you feel tired? Does something hurt? Are you sick? Same thing with our mental health. So our brain is no different than our physical ailments. Good mental health, I would say, is that there is clarity. You might not necessarily feel happy, but you would be content, right? There's stability. There is nothing that's overwhelming in your life. So it's basically, I guess to answer the question better, mental health is, how you feel mentally and emotionally. Sometimes the tricky thing with mental health is sometimes physical ailments can lead to mental health issues. So sometimes they can be tied together. But in general, it is just how you feel. How you feel mentally and emotionally in your day-to-day life. So I would say that that would be my definition.
I like it. It is a lot of comparisons, and I like to do that too with physical health and emotional health or mental health. It is like the same thing. The same thing. We compare both, and it is a state, right? A state of well-being. Is it the physical, being physically okay, then we are physically healthy. And mental health, it is the same thing, right? If we are in a state of well-being, emotionally, mentally, then we call that the mental health. The ability to manage situations, to adjust to situations, to respond to things appropriately. You think that?
Good, yeah, good response. That's why she's the boss, right? So, all right, good.
Yeah, but I like that. Physical health and emotional health. And we say, mente sana en cuerpo sano. How do you say that?
Healthy mind, healthy body.
Right? So they go together. So, okay. Now, speaking of mental health, what do we do to work on improving that or to manage that? We do therapy, right? Therapeutic services then are provided through different professions and professionals of mental health. We have different kinds of therapists, and we would like to talk a little bit about that today. Um, what is the difference between all these titles of therapists? You know, marriage and family therapist, clinical social worker, certified professional counselor, psychiatrist, psychologist. It's a lot of different titles that sometimes we hear and we may be confused with what they are or what is the difference on the similarities between them. So, what do you think if we start with the definition um, of those titles, right? Of those therapists that have a title. How about CPC? What does that mean?
Okay, so good question. So, yeah, so, we are often asked that, not just through the website now, but just in general, right? So, what are all these letters, right? Some of you might think, why do these people have the alphabet at the end of their name, right? Doesn't make sense. So, yeah, so let's start with CPC. So a CPC is considered a certified professional counselor. So that is a type of counselor or therapist. So counselors and therapists, they're kind of used interchangeably. The word they do have other meanings, but kind of in today's world, basically we mean the same thing. So it's going to be a therapist. But CPC, it's a specific title, a specific type of therapist or counselor, and it stands for Certified Professional Counselor. Now, or clinical, I'm sorry, clinical or certified.
Oh, certified too. I heard those both, clinical professional counselor and certified professional counselor.
Correct. Yeah. So let if I can give you guys a little bit of information on what a CPC is, or where they come from, right? So I'm not a CPC, so I will give you the information I know. So basically, in order to be a CPC, you have to hold a mental health degree. Doesn't necessarily have to be graduate, I don't believe, and for those CPCs or MFTs out there, if I'm talking out of context here, please let me know. Don't hold it against me. But as far as I know, they don't have to necessarily have a graduate's degree. They can have a bachelor's just in a mental health field. So that can be social work, can be psychology, can be counseling, can be, the list goes on and on. I believe there are particular programs that are labeled as mental health counselor that they will accept as well. Now, whether the school or the degree that they get is accepted or not will depend on their board. So for a CPC, the board that they are governed by here in the state of Nevada is the Board of Examiners for Marriage and Family Therapists and Clinical Professional Counselors. So that is who basically decides, yes, your credentialing is okay, and yep, you can go ahead and start practicing. So yeah, anything to add to that, Norma?
Yeah, I was thinking about that. Having the clinical professional counselor, there is two different things also. Having a degree is one thing, and having a clinical license to practice is as a therapist is a different thing. Mm. Having the degree of clinical professional counselor or certified professional counselor does not qualify the person to give therapy, to provide therapy, to be a therapist, right? You can have the degree, but you cannot practice as a therapist, right?
Correct.
So after that, yeah, they need to complete also some paperwork with the board, and if they want to complete now the clinical license as a certified professional counselor, then they can practice as therapists. So they're the two different processes. The degree that they get out of school, and to get the license is a different process that they need to complete to be able to do therapy and to provide services as a therapist.
Yeah, and just to add to that, I think I knew what Norma meant. I think she misspoke a little bit. So if they have the title of CPC, that means they can practice. I think what she meant was if they have a degree in a mental health field, it doesn't necessarily mean that they can practice. So that's why we have those letters to let the client know that, hey, we can practice, right? So as she said, so the degree is one thing. But once you get the degree, then you have to go to this board, right? In this case, it would be the Board for Examiners for Marriage and Family Therapists and Clinical Professional Counselors. You would have to meet their qualifications, which oftentimes is and this is across all the board for all type of therapists. They're going to be required to do some type of internship, right, and be supervised while they practice. And then after some time, they will have to take an exam, which will license them to be able to practice. Now, I'm going to jump ahead a little bit just because they go together. So, if you guys have been paying attention, I've been saying that the board here for CPC is the Board of Examiners of Marriage and Family Therapists and Clinical Professional Counselors. So for MFTs, which is the next topic we're going to cover, they are licensed marriage and family therapists. They are under the same board, and they have the same qualifications, so they would need a degree in the mental health field, and has to be accredited and approved by their board. Again, if they want, after they got the degree, if they want to practice therapy, they would have to apply for it through the board, have to do some type of internship and supervision, and then, ultimately pass a test in order to get licensed. So, sorry if I jumped ahead, but anything to add to that?
Yeah, no, the marriage and family therapist was the other title or the other degree, and they are the requirements are maybe similar, but not the same, but they are under the same board for them, those two. Then we have, let's go with CSW? Or you want to go with, we talk CSW at the end,
yeah,
because
sure.
it is us.
Sure.
So we have now a licensed psychologist. So what is the difference? A lot of people sometimes here get confused. They say, are you a psychologist? Or are you, what are you, right? So what is a licensed psychologist? Now, what is the difference with a psychologist?
Well, so good question, Norma. So licensed psychologist, a lot of times after their name you will see an LP, which means licensed psychologist, right? So there is a couple of differences. I'll wait to explain if it's all right until after we talk about what we are, which is clinical social workers. But I'll try to do a better job of explaining the differences. But just focusing on psychology, so that is. Or a licensed psychologist, that is somebody who they have to get a doctorate's degree actually, so not a master's or bachelor's, so they have to go past graduate's level, and they have to get a PhD in psychology. So somebody who is a licensed psychologist has gotten a PhD in psychology. Again, along with that, they would have passed their degree. If they want to practice therapy, they will have to meet the requirements of their board, which their board is the Board of Psychological Examiners here in Nevada. And part of the requirements, I'm not going to go through all of them, but again, they're going to be similar. So they're going to have an internship portion where they're going to be supervised while they practice therapy. And then after meeting a certain amount of hours, they will be able to take a test, and they would have to pass their test in order to get that license. So, again, psychologist, and I will say, hopefully no social workers out there get upset. I will say it probably is the toughest, but simply because they require a doctorate's degree, so they do have to have that PhD. So a licensed psychologist cannot be licensed without that PhD. So they do have to have that PhD. Again, they would have to meet all the qualifications of the board in order to take the exam and then pass their exam before they are considered licensed. So, anything I missed?
No, I think that's it. The time required is much longer. The process is similar, but the degree that there has to be is a PhD, and then the internship. So some similarities again, but differences too. Now, LC. What else?
Well, no, go ahead. I'm sorry.
Oh no, I was gonna go to the next one too.
Okay.
The LCSW.
All right.
What is LCSW? We are LCSWs.
We are. So now before I move on with that, just because Norma tends to be shy, so just for you guys, for your knowledge, Norma is actually an LCSW, but she is also a licensed psychologist. However, she's not licensed in the United States as a psychologist. She is licensed in Mexico as a psychologist. So she actually went through the process twice. So she went through the process in Mexico, and then when she decided to practice in the United States, she went a different route. So instead of going through psychology, she went back to school to be a social worker, and then got her license in social work, so she's actually licensed in both, guys. But yeah, let me get to the question now. So, so an LCSW, so that stands for Licensed Clinical Social Worker, which is primarily, well, that's what we are, as she said, and that is primarily what our therapists here at Bilingual Center for Behavioral Health are. We do have a couple of CPCs. One will be joining us soon, and then, but outside of that, most of our therapists are LCSWs, for those of you that might be wondering. In order to be an LCSW, you are required schooling, so your degree has to be in social work, and you do have to have a graduate's level degree. So you have to get your graduate's level in social work from an accredited school. At that point, if you decide to be a therapist, again, as with every other title here, you will have to meet the requirements of the board, which here in Nevada is the Social Work Board. And so that will require you to meet a certain amount of hours practicing under somebody who's supervised. And then once you meet those hours, you will have to take the test and pass the test in order to get licensed. So, yeah, so anything else regarding LCSW?
LCSW, no, I don't think. No, it is what you said. It's in getting the degree, getting approved to complete your internship, completing time and hours and training, completing another test and passing another test, and then you get your license as a clinical social worker.
Yeah. Now, if I can add a couple things. So I will be very honest, and I apologize ahead of time. But let me try to do a little better job to clear up what all these titles mean, right? Because we basically explained what the letters mean and you know, how they get there, but we haven't really explained what do they exactly mean, right? So I'll be completely honest. With a clinical professional counselor, I really don't know. So I am sorry, right? Maybe Norma can help me out here at the end there to explain that one. Now the marriage and family therapist, it's in the name, right? So their focus is marriage and families, right? So they focus on couples and they focus on families. That is, you know, that is what their curriculum focuses on. So if you were looking for, you know, like a specialty, I guess I could say, you know, and specifically maybe for couples counseling, or something to do with the family, marriage and family therapy. That is, although they can do other types of therapy, they're not constrained to just that, but that is what their curriculum kind of focuses on. As I said, CPC, unfortunately, I really don't know too much about their schooling, so maybe Norma can let us know a little bit about that.
I don't know much about CPC either, but I know they have it's more focused on counseling. We have actually a CPC intern that we may interview another day to give us more explanation about that. But it is, they don't have a specific focus on a subject like marriage and family therapy, or for us like social work. It is a professional counselor that it is more broad. But at the same time, if they want to work on specific areas, they need to have and go get specific training on those areas, because they are more counselors in general.
Okay, good. And yeah, maybe like you said, you know, we will have a CPC here, so maybe we will interview, or any CPCs out there that are looking at this. If you have your own comments, or you're like, hey, you're making it sound bad,
yes.
you know, feel free to message us, and we'll pass on your message. Or if you want to be part of our podcast in the future and kind of explain, you know, more about CPC, we will definitely give you that opportunity. Now, moving forward, psychology and LCSW. Those I am definitely more comfortable explaining, right? Obviously, I'm more aware of those. So the difference that I explain to clients, and typically those are the two things that clients come to me about, or just people in general that walk in the door. They want to know, well, what is the difference between a social worker and a psychologist, right? So the difference is that we're better. That's the difference, guys. So, no, I'm just joking. That is not the difference.
2 words.
So just jokes, guys. No. So the difference is that I explained is the easy way to kind of figure it out. Psychologists, they look from inward out. So meaning they look at any mental health illness as starting from inside of you, right? So it's primarily the brain, right? So there's something wrong with how your brain is functioning, and that's why you are having a mental health condition. So they look to treat that, and then they kind of work outward. Where a social worker looks from the outside in. So as social workers, we feel that the environment around us, our financial needs, things that are happening around us is what causes mental illness, and we try to focus on making sure that whatever those outside things that are affecting us are stable in order to be for our mental health to be stable. So those are the two differences, and that's the best way I explain it. Now at this point in time, a lot of psychology and LCSW, as far as school goes, it does overlap, so I can say that we pretty much study the same stuff, but where the difference is, as I said, is the framework we come from. And our framework is that we believe that the outside world affects our mental health, where psychologists might argue that the inside world is actually what affects our mental health.
Mm-hmm. Yeah, I think that's one of the differences I've noticed too. The training or the being a psychologist or being licensed as a psychologist, you focus on the person, just as a person, right? As an individual and the situations or the issues or the problems that you may be facing as a person, and what can you do to solve that. The difference that I noticed with social work is, we assess and evaluate and take in consideration many other things, from the family, the community where we live, the resources that we have, and looking for connection to those resources, and looking for help and support outside, like we said, just outside ourselves, but what other resources we can count on to overcome the difficulties that we may be facing. And that is also what I have noticed. As a social worker, we focus on other areas that may be affecting us individually, but we also recognize how the environment affect our well-being, and what can we do to solve that. And we do sometimes the interventions may be the same that we use, and the treatment may be similar, but there is also one big difference. We cannot do psychological testing as clinical social workers, and licensed psychologists, they can do psychological testing. Just to do specific tests that can be done for a specific diagnosis. Psychologists can do that. We cannot do that.
Yeah. So maybe some of the stuff that you guys might be familiar with, kind of what Norma's saying is, for example, I'm sure you guys have seen the testing with the ink blotter, where they show you a picture and they ask you, hey, what do you see? So that would be a psychologist. We would not be doing that. However, if you want to see a social worker, don't feel bad that we can't do that. If in our practice, or at least I can speak for myself, if there is a reason that I feel that one of my clients might need a psychological test for a specific thing, I would hope that most social workers are knowledgeable enough that they will continue to see the client, but they will refer you to a psychologist to get that specific test. And then once we receive when we receive the feedback from that test, we will continue to work with you. So just because we're not allowed to or not trained in doing these testings doesn't mean that you still can't get it done if you see a social worker. You can still get it done. It's just going to be a different process. But yeah, anything else, Nora?
Yeah, we can do it the same things that a psychologist can do. What I have noticed also here in Las Vegas is that psychologists, their focus is on testing, not that much on treatment, but it's on testing. And we do referrals to psychologists to complete a testing, which is lengthy evaluations that last sometimes 2-3 days, several hours, but they focus on that. But we, as clinical social workers, we are also trained to do assessments, provide a diagnosis, and treatment. So it's assessments or evaluation, diagnosis, and treatment, the three things. What I've noticed a lot here with the psychologists is that they focus on the assessment and the diagnosis, but not that much treatment. That's another thing that I have noticed.
Okay.
Yeah, but we can do the same thing. If, like Luis said, if we believe that there is the need for a psychological evaluation, and sometimes it is for people want to know their IQ, right? Sometimes, so there are tests for that the psychologists can do. There are specific tests for psychosis. Sometimes, so some diagnosis for psychosis. If it's more specific on those areas, there are specific tests that they can apply, the psychologists. But that doesn't mean that we cannot do the diagnosis without them. So it's like we can do it, but sometimes we just see that as an extra resource to have a more well-defined course of treatment. I mean, the more information we get, the better treatment we can give. But I noticed that psychology is more focused on the testing, but we do more the treatment.
Yeah, so good. All right, well, moving on, guys.
Yeah, so now we talk about those like therapists, right? We all are therapists. CPCs, LPs, LCSWs, MFTs, psychologists, we are all therapists, right? But now, how about a psychiatrist? Now that's something different. What is a psychiatrist?
Good question, right? So that is the other thing. So outside of what's the difference between you and a psychologist, the other question I hear a lot is, can you give me medication? Right, so here's where a psychiatrist comes in place. So a psychiatrist, so they are a medical doctor. That is, the easiest way to describe them. So they need a general, I believe it's a bachelor's degree. It can be in any field. Again, psychiatrist, I apologize if I'm wrong here, but I do believe it can be in any field, other bachelors. So they need a bachelor's in some type of field, right? So once they get that, somebody who wants to go into psychiatry would have to get accepted and complete medical school. So once they get accepted, they will have to go through further training to become doctors. And then once they complete medical school, they will have to go into, again, get accepted and complete psychiatry school, which will, or a psychiatry residency, I apologize. So, I mean, technically it's school, but it's a little bit different. So they'll have to complete a psychiatry residency after completing medical school. And then they would also have to take a test once they complete the residency that will license them as a psychiatrist. So, so that's just general what they are, right? Now, what do they do? Well, as I mentioned, they give medication. Now, in general, one of my biggest complaints that I get from my clients, I don't know about you, Norma, but if I feel or recommend that a client see a psychiatrist, maybe because I feel that they need medication, or maybe the client says, you know what, I want to have therapy, but I also want medication. I will refer them, right, to a psychiatrist, and then they will come back in a week or two and say, oh, that was the worst experience ever. They, they're very cold. They asked me like 3 questions. I was in and out in like 5 minutes, and then they gave me this medication. They didn't even take the time to explain the medication, and oh man, it is a horrible experience.
Yeah.
Do you get the same?
Yeah, it is like that too. That's what they come and say, yeah, I went to see the doctor, but they don't even listen to me, or they don't even talk to me, or they just ask a couple of questions. Here's the prescription, leave, and see you in a month, or see you, usually in a month. But yeah, the people, most of the time, not all the time, but most of the time, that is the complaint from the people that come here to see us, that the medication, or the psychiatrists, they just are cold, that they're not listening, they don't give them the time. It's like 5 minutes in and out. But it is, yeah. Sad.
Yep. So, now for all you out there that have experienced that, feel free to comment on it. Keep it tasteful. But for those of you who have experienced that or who haven't, I will let you know that that is completely normal, guys. It is normal. It is not to get into the history, but one of the reasons why social workers came about, because doctors are cold. But it's not because they don't care. They really do. But they chose to be a psychiatrist for a reason. That's what I tell my clients. They could have chose to be a therapist, but they chose to be a psychiatrist for a reason as opposed to a therapist. So they're not necessarily there to to hear your story and try to help you out as to why. They're really just there to treat your symptom, right? So if you tell them that you are sad, they're going to give you medication because you're sad. No different than if you went to a primary doctor because you have a runny nose. He's going to give you a medication to treat that symptom, which is a runny nose. So he's going to give you medication for the runny nose, and that's it. So that is why they seem cold, because they're just asking questions because they want to know what your symptoms are so they can give you medication for your symptoms. But it's not because they don't care, guys. It's just not their, it's not their field. Although they are mental health, as far as being a therapist, it is not their field. There are some psychiatrists out there. As I said when I started, they just need some type of degree. There are some some psychiatrists which their degree is in either social work or psychology, and they will tend to probably be more open and more engaging. However, again, guys, just keep that in mind. It is not their field. They're not therapists, they're doctors, so that's why they seem that way. But that's why I always recommend that you have a therapist if you are on medication. But I think that might be skipping ahead. But anything else to add to that, Norma?
No, like that. If they focus more on the medication management and just making sure that the medication, maybe the first time is trying to see, what is it? Oh, I cannot sleep, or I am so worried and I am anxious. Okay, here's the medication. Try, see you next month. Next month, what they do is just follow up how the medication is working, right? So it is following up on the symptoms and on the medication, and then what they do is try to adjust the medication, but that's the focus, medication management, right? Not that much on the treatment. As a therapist, to be talking about it and to give you the time. Now it is medication. Okay, then if it's okay, good. Here is your prescription again. Take it. See you next month. If it's not working, okay, then try this other one and see you next month and let me know how it is going. But if the focus is more on the medication management to treat specific symptoms, but not what is behind of all the symptoms, right? That's what we do.
Good. Anything else, Wilma?
When to consider medication then. Now we're talking about the psychiatrist. They prescribe medication, we don't. Sometimes people come here and say, oh, can you prescribe medication? No, we cannot prescribe medication, but we can refer to a psychiatrist that can prescribe the medication. But when do we consider medication? When do we think it is right for us?
Good question. So that is a tough question to answer, and it's not that tough, right? So I would say something definitely if you have a therapist, something to talk to with your therapist. Or if you have questions, then maybe go see a therapist and then talk about it with your therapist if you have that question. But in general, to answer that question, what I always tell my clients is it really is up to you. There are very rare occasions where I will let a client know that I very strongly recommend medication because of what I'm seeing. Most of the time, it's not like that, right? Most of the time when clients come see me, it is something that's manageable just with therapy. However, as I said, it is really up to you, the client, to decide whether you feel it is going to be something that is a good fit for you, or something that maybe you want to try to kind of attack without taking medication. So there really is no right or wrong answer. I always tell my clients, whatever answer whatever decision you make, that's going to be the right decision. So my only thing for my clients, I don't know how Norma does it, but I always tell my clients, if you just, my only thing is if you decide to take medication, then okay, we're going to do this. We're going to take medication. If you decide you're not going to take medication, then okay, then that's the decision. We're going to go at this without medication. What I don't like to see is what's called kind of yo-yo cycling medication, where you try it and then maybe you feel good for about a week, and then you decide you're not going to do it anymore, and then maybe you feel bad, and then you go back on medication, because that's where all of these issues that kind of get brought up to mainstream happen, is typically because clients are not taking medication as prescribed, and they're cycling medication or yo-yoing medication instead of just sticking to one path or the other. So yeah, so my answer, I know it's long-winded there, but my answer is it's really going to be up to you, the client, to decide. Whatever you decide, that's going to be the right answer.
Yeah, I agree. The people decide if they're going to take the medication or not. What I ask them is, why are they consider taking medication? If it is, let's say, I'm so anxious and I want to try medication, then I ask them if there is something that they have tried before the medication, and if it is something that we can work without the medication, then we try something before the medication. Because of we talk about of the people that come here, we talk about them, right? Medication, it is not bad when it's needed, but if we just want to depend on medication to make things easier for us and not do the work that we need to do, it's like taking a pill to lose weight, right? We can do it, and maybe we can try to lose weight that way. Why? Because we don't want to put the effort on doing things that may be a little bit harder, but it may be less invasive. There are side effects for medication. There are no side effects for trying all them, let's say, relaxation, breathing techniques. So then I check with them too, what is the reason why they want, and if there is something that they can consider before trying medication, okay. If they are willing to do it, then let's do it. If they think medication is the best thing, then it's up to them too. And then that's it. There are certain times also, I think, for us, when we can not work with a person unless they are on medication, and now we're talking about psychosis or things when the people are also not stable and not functioning well to be able to engage with therapy. Then those times the medication is necessary, and I guess that those couple of things.
Yeah, and to add to that, covered everything greatly there. But yeah, to add to that, again, I go back to my original statement. If you really are questioning, then hopefully you have a therapist that you can kind of bounce the idea off of. And if you don't, then maybe schedule an appointment with a therapist and then have them discuss it with you. Because again, no therapist should be telling you should be taking medication, but at the same time, they would know if, you know what, I think it's a really good idea if you do decide to take medication, or if the therapist just lets you know that, you know what, either way is fine for me. If you want my advice, I don't see that either way is going to damage you. Then you kind of have a better answer, right? Because as Norma said, there are some situations where it would be strongly recommended for a person to be on medication. But I would say in the majority of cases, most patients can, as long as they're willing to deal with the symptoms that they're dealing with, that they can manage with just therapy.
Perfect. So I think one last thing. Now, if a person decides to take medication, do they still need to see a therapist?
Oh, man, good question. So, again, so there's no right or wrong answer here. This is going to be up to the client, right? I guess going into psychology a little bit, right? Even though I'm a social worker, there are some people that are born with some chemical imbalances. That's just how they're born, right? And I'm not even going to get into anything extreme. We'll just talk about sadness or depression, right? There are some people that are just naturally born in a different wavelength, or however you want it. They're just born a little bit more melancholy than most people are. And that's okay. There's nothing wrong with that. But maybe they don't want to feel like that anymore, right? So for those clients, maybe they take an antidepressant, and all of a sudden, they're balanced, because now they're balanced, right? And for those clients, they might be okay with that, and they might be able to get away with that for the rest of their life, right? So they might start on medication, and maybe 20 years, they might have to up their dose a little bit, and then they can go the rest of their life with that, and they're okay with that. So if they are okay with that, that is on the client. Personally, typically what I always recommend to a client is, outside of those rare cases where it is some type of chemical imbalance that you were just born with, as we've discussed before, and maybe this comes because of the framework that I've studied, is most things, most symptoms are caused by your environment, or the things that are happening to you or that occurred to you. So let's process that. So if you really want to get down to the bottom of the why, and you really want to fix it, then let's go ahead and do therapy. Let's process it, and let's make sure that you're not dependent on any type of medication moving forward. Because as Norma had said, the medication really, it just kind of masks the symptoms, right? Just like physically, we started with physical well-being. If you go to the primary doctor, I use this example a lot as well, and you got a cold, unless it's a bacteria, if it's a virus, if you have a cold, they're going to treat the symptoms. Your body takes care of actually treating the virus, right? So no different with our mental health. So if you go to a psychiatrist, that medication is going to treat the symptoms, but your mental health is still going to be ill. So if you come off that medication, you're still going to feel the same that you did before, because you didn't take care of the issue. So the only difference is your brain doesn't heal itself. That's where therapy comes in. So I guess, again, another long-winded answer here. Personally, I would always, and maybe I'm biased because I'm a therapist, but I would always recommend therapy, even if you are on medication. But at the end of the day, as I said, that is ultimately up to the client. If they are comfortable with that, and maybe they don't want to get into some of the deeper stuff, then it's okay. But as a therapist, I'm always going to recommend therapy. How about you?
Absolutely. That too, I agree with everything he said. At the end, patients decide if they want to take medication or not, and they decide if they want to come to therapy or not. But of course, if the medication is needed and is being taken by the patient, then the best thing to do is also work on the other area, what's behind all that. So working together may be the most recommended action to take, but at the end, it is the patient who decides what is best for them.
Awesome. Right? Yep. So is that all the questions, Norma?
Yeah, that's all the questions. Those are all the questions for today.
Okay. Well,
yep.
Thank you guys. We appreciate you guys that commented and that submitted questions. We ask you guys to do it again for next month. Let us know any questions you might have, any topics you might suggest. Again, don't forget to subscribe and like. And for any additional information regarding Bilingual Center for Behavioral Health, look us up online at bcbhlb.com. And yeah, we look forward to seeing you soon, and we look forward to your comments. So thank you guys.
Perfect. Thank you.
Bye-bye.
Bye-bye.